Well, I would like to take this opportunity to welcome everybody that is here today, and we'll be happy to go over these changes with you so you know what is coming up for you for next year. Just one thing that I wanted to point out, I sent a letter to everybody about my new location here at 816 Washington Avenue. It's only a block east of where I was before. So still simple to get to. Um, if you would wish to have an appointment, notice I have the QR code down here that can be scanned, and you can set an appointment. There's three types of appointments: in my office, on Zoom, or over the telephone. So those are the three ways or the three types of appointments I'm doing this year. There's quite a few changes, especially if you're taking brand name drugs that could affect you. So you may want to consider that. If for some reason you can't scan that, we got the old telephone here that you can use to call. So the further I go along in this business, more technology I have to use. So I'm bringing you along with me to do that. So we're going to look at the Explorer PPO and the HMO Connect plans. Um, if you're on the call, you have one or the other. Okay, they're both zero premium plans. So let's take a look at what we got going here. So we'll look at the premium, maximum out of pocket, provider and pharmacy networks, changes to the benefits and costs, and the big changes to Part D or the prescription plan. So the premium for the PPO, and that's where we're starting, is going to remain $0. So no big change there. The premium for the dental is different. In 2024, the HAP offered three different dental plans. Well, now they condensed them all down into one, and they're all $19.90. So that was an excellent change. The maximum out of pocket 2024 was 5,200, and that's where it's going to stay for next year. And the maximum out of pocket only includes it only includes medical expenses. So it says costs for prescription drugs do not count toward your maximum out of pocket, nor do other things like dental, vision, or hearing. Now, because this is a PPO, you can go out of network, but it does not change your maximum out of pocket. So there's not one pocket for the out of network costs and another one for the in network costs. It's all combined into $5,200. You want to make sure that your drugs are going to be covered this year. So there's a lot of things here concerning your pharmacy. Make sure they're still in the network. Also, check out any new doctors you have. Check out your current doctors. I can help you do that. And make sure that you don't have any surprises. Doctors can go in and out of these networks in the year, and you're not always notified when that happens. So best we can do is look at what's going on now and hope for the best. Ambulance services still remain at a $300 copayment. One new thing about this is that currently you paid 40% coinsurance for an out-of-network ambulance. Now they've made that a $300 copayment. So that's probably better than the 40%. Dental services have changed a little bit. This is still through Delta Dental. This year you had $3,000 worth of dental benefits. That was lowered to $2,000. But a good thing is that they are now covering crowns. So this year it was only crown repairs, but now you get your crowns covered and you'll pay 50% for all of these things down here: root canals, fillings, crowns, oral surgery. You still get your preventive services covered at 100%. Something new for HAP for all plans is a flex card. This flex card, as you know, is not available this year. For the PPO, it'll have a $80 allowance loaded onto it every quarter, and it will roll over if you do not use the entire amount. So you use that for your over-the-counter items, okay? And you can go to retail stores, your Walmarts, Myers, so forth, and also to pharmacies. So you're going to receive a prepaid benefits MasterCard to use for this. And if you have one of these types of health conditions, and there's more than this, you have to look into the policy. But if you're diabetic, have cardiovascular disorders, chronic lung disorders, cancer, dementia, you can also use this $80 towards healthy food. Hearing aids, that has changed somewhat. This year we only have 4 options of hearing aids with all of these different types of co-payments. Next year you're going to have 6 options for hearing aids. So there's a much wider range of co-payments that might make it more affordable if you're looking for that. For outpatient diagnostic tests, for certain things, you're not going to pay anything in network, but out of network, you're going to pay 40% for those tests, like ultrasounds, especially for peripheral vascular disease, ultrasounds, pacemaker testing, those types of things. If you use your HAP plan for mental health or substance abuse services, now this year you'll have to make a co-payment of $15 in network and pay 40% for out-of-network services. So just to reiterate on over-the-counter items, this year it was $70 every 4 months, so they bumped that up to $80 for each quarter. To go to the emergency room is now $125. Remember, that covers everything that goes on in the emergency room. You will not have separate co-payments for this doctor and a separate co-payment for the room and a separate co-payment for the test that they take. It's all $125. Same thing for urgent care services. It's a $45 co-payment. We're going to talk a little bit about drugs now. This is very important. Review your drug list to make sure all your drugs will be covered next year and to see if there will be any restrictions, or perhaps it's at a different tier. I just talked to a lady today who had a drug that was no longer covered. So we had to find something that would help her out, and fortunately we did. What's new on the drug front is that there are 3 stages now to the way drugs are covered. This year there was 4, and I'm happy to say that the coverage gap or the donut hole will no longer exist in the Part D benefit. So you have a deductible stage, an initial coverage stage where you pay up to 25% of the drug. Once you reach $2,000 in out-of-pocket expense, you go into the catastrophic coverage where you have 0 expense in that level. And I'm going to talk more about how that works. There is a yearly deductible now on prescriptions. And for this plan, it's $300, but it only applies to tier 3, 4, or 5 drugs. So tier 3 are brand name drugs. Tier 4 is non-preferred, and tier 5 is a specialty drug. So once you satisfy that deductible, For those tiers, then they will have percentages that you will pay, a percentage of the total cost of the drug. Tier 1 and Tier 2 drugs do not have the deductible applied to them. So those are still very low cost. In the initial coverage stage, which is the second stage, you'll pay up to 25% of the cost of the drug. In 2024, a preferred brand name drug was $41 a month. For 2025, that is going to change to a coinsurance of 15% of the cost of the drug. Okay, so that is a difference. You'll see less co-payments on the drug plans now. And this out-of-pocket $2,000 does not mean your actual spending of $2,000. No, instead, the plans look at the total amount of the drugs. And if they total $2,000, then you're done paying for your drugs. And I'll show you an example later. Another new feature to prescription drug coverage is you can stretch out your drug costs over the year by making monthly payments. Now, it's not going to be beneficial for everybody, and you do have to be careful with it because there can be a backfire if you don't look at this the proper way. So you can sign up for this plan through HAP or even your pharmacist. Okay, so now we'll talk about HAP Medicare Connect HMO. What are the changes going to be? Some of them are the same as we've already talked about. The premium remains at zero. The dental benefits have all changed. They still are all down to one benefit for next year, paying one premium. The maximum out of pocket went up from 4,500 to 5,000. But again, don't worry about that number. That's just a number that's an indicator. Dental services work the same as the PPO, down to 2,000, and they're covering crowns. This will also have a flex card. It will have $70 every 3 months with rollover to the next quarter. Hearing aids, again, a further selection than we had last year. Your therapy services like physical therapy, speech therapy went up from $15 to $20. The skilled nursing facility is $214 a day. Again, we have the emergency copay of $125 and the worldwide urgent care of $45. Also, the changes to Part D or the prescription coverage are the same. Couple of differences. For this HMO product, the deductible is only $150, not $300. Also, the cost of the insulin increased. This is the insulin that is on the insulin savings program, went from 25%, $25 up to $35 a month. The prescription payment plan applies to the HMO as well. So this is a little chart on how the Part D has changed. So remember, there's 3 stages: the deductible stage, the initial coverage stage, and catastrophic stage. So whatever plan you have, your deductible is either 300 or 150. So once you pay that deductible, okay, then you're going to move into this stage here, and you're going to pay up to 25% of coinsurance for your medications. So when you reach that $2,000 maximum in coinsurances, Then you move to this stage and you pay nothing for your medication. It's covered at 100%. So only 3 simple stages to know about. And this plan down here, this part of this talks about the payment plan. Um, the payments can be capped, so you can kind of measure out through the year if that's going to happen with you. If you are taking drugs that might be $50 a month, this does not really help you out a lot. It's for individuals who are taking expensive drugs and they want to try to even out the cost um, as they go through the year. So that's the new 2025 plan for prescriptions. Now, this here is a typical list of prescriptions. You got this person has eye drops. She's got some high blood pressure medications here and here, got some pain medication, got the statins and a couple of other types of drugs. So I'm showing you this because here's what you would pay in the deductible, but only for tiers 3, 4, and 5. So tramadol here is a tier 3, so you'd have to pay the deductible on that. So you'd pay $11 a month throughout the year. The other ones don't have a deductible, so you're going to pay everything from this column. And as you can see, there's not enough expense there to get you into the catastrophic. So this is quite affordable, and you wouldn't want to even get into any type of payment plan with this. However, what if we added a brand name drug such as Eliquis, which is very expensive? That's a tier 3. So we're going to go over here and notice that the payment for Eliquis is $146. That's because it's 25% of the cost of Eliquis. And the total cost, if you had a deductible, you would have to satisfy that deductible first, and then your initial coverage stage would be the 146.12. Now, the out-of-pocket expense of $2,000 is not based on this column of costs right here. It's based on this column. So if all of these things add up to $2,000 over a period of months, then you're done paying for all your prescriptions. Now you're in the catastrophic level. So that's how that works. It's the total cost that is looked at for this. So individuals who are taking expensive prescriptions, you may see quite a break in your expenses with this part of the new program. Here's a difference in 2024 for Eliquis, you made a copayment of $42. And remember what we did for 2025? $146.12. So it's about $100 difference every 30 days. So that's where the 2020 or the $2,000 maximum out of pocket is going to help people. So I want to remind you to read your policy, right? That's what everybody does as soon as they get it, right? So yeah, read this over. It's got details. We just looked at a high level view of the changes. There's more details that you can look up in your summary of benefits or even more details in the evidence of coverage. So again, I want to remind you, scan this to make an appointment or give us a phone call. You know that my services are always free. I encourage you to get in contact with me so we can look at your drugs. The individual that I talked about saved $900 by making a switch, and it was worth the time for her to come and visit. So again, let me know how I can help you out, and I appreciate talking to you, and I appreciate your business. Thank you. Bye-bye.